Amazing. Thank you everyone for your patience. We can hopefully get started. Ashley, do you want to mute for now? And I can, I said, do you want to mute for now and I can just kick things off and then hand it over to you? Okay, perfect. Thank you everyone for joining us today. So excited for this discussion and flow about moving your body during pregnancy and postpartum. We've got some people that are actually in person at We Yogis in Dallas. And so really excited to get this flow going. One of my best friends just had a baby 3 months ago and was just talking about getting back to yoga. So I feel like this will be perfect timing. As a quick reminder, we'll record this session and share it with attendees after. And I'll do a quick introduction just to Ashley, let her do some pelvic floor 101, and then we'll get into the flow. So just a little bit of context for everyone joining us today, both virtually and in person. And Ashley, can you all hear me on your side? Or I'll just quickly turn it over to you.
Yeah, we're all good.
Okay, perfect. Great. Well, I'll let actually, I'll just introduce the Ashley and Erica, and then Ashley, I'll just hand it over to you. But we have Erica White from We Yogis, who has a ton of background in sort of prenatal yoga, has done a lot of certification around additional training, and also has 3 kids, including a 3-month-old. So we'll have a lot to share about her own journey as well. And then we also have Dr. Ashley Rawlins, who is a PT with Origin based out of Dallas and works with women really from a full body perspective, but specializes a lot in pelvic pain, pregnancy related pain, postpartum recovery. And she's going to give you a lot of the primer today on your pelvic floor. So with that, I will kick it over to Ashley, and I can go through these slides, Ashley, but you can just kind of talk through for the people in person.
Awesome. Thank you so much, Allison. How's the volume?
You're great.
Okay. So you guys all good in this room, right? Okay. Yeah. So again, like she said, I'm Ashley Rawlins. I'm a pelvic physical therapist, and I'm joining you all today to kind of help, I guess, get some of the word out about our pelvic floors, how that relates to pregnancy, postpartum, return to exercise. I'm a pelvic physical therapist at Origin, and we're on a mission to help every woman feel their best throughout every stage of their life. At Origin, we offer physical therapy in person and virtually. So what I wanted to talk about today, though, was pelvic floor 101, kind of what is the pelvic floor? How does it relate to all of this? And then kind of go through changes in your body in pregnancy, postpartum, and when to see a pelvic PT. Kind of from the get-go, physical therapy helps in general, movement, exercise. Doing physical therapy, though, can reduce your risk of postpartum depression by 50%. So it's important to, address what is going on. So what is my pelvic floor? It's something that we talk about all the time, or maybe you hear about it, maybe your healthcare providers talked about it, like do your Kegels, get you pregnant, or do them in the postpartum period. But what does that even mean? So your pelvic floor is this group of muscles at the bottom of your pelvis. It goes from your pubic bone to your tailbone and between your 2 sit bones. It's like a hammock that holds up your pelvic organs and helps to support all of the functions, which are vast. First, it helps to support and hold those organs up against gravity, and the growing baby up against gravity. It helps with continence, so squeezing and closure around your pelvic openings can help reduce urinary leakage, bowel leakage, helps to provide stability in the pelvis, along with your core muscles, your diaphragm, your back, your abdomen. Your pelvic floor helps to support and stabilize your spine and your pelvis. It also is extremely important in sexual function. So for erection, pleasure, orgasm, arousal. And then it also acts as a pump to help pump blood and lymph flow and everything like that. Any questions right off the bat? Okay. So why is it important, and how does your body change in pregnancy? So much changes in pregnancy. Some of you guys are pregnant here and you probably are feeling the changes. As your body grows, your abdomen grows forward, and that can, of course, lead to postural adjustments, right? As your body's growing forward, you don't want to fall forward, so we tend to start to lean backward. That just changes everything up the chain, including So we still can't see, so we have to kind of adjust forward from here. I know this is like a dramatic posture, but these are kind of, it's a little bit more subtle in pregnancy, but these changes occur. And it affects the way our muscles function. It affects the way we move, the way our joints are aligned. And we make all sorts of compensations. Additionally, our pelvis tilts forward because everything is growing forward. And that's kind of one of those adjustments. And that can lead to shortening of muscles, like your hip flexors in the front here. If we have that anterior tilt of the pelvis, it can contribute to shortening. And you stay like that for 9 months and your muscles can become shortened. It also makes it more difficult for your abs and your glutes to contract. If you're standing with this big arch and you're trying to contract your abdominal muscles or, your glutes, your muscles when they're kind of over lengthened like that have a hard time contracting and being assisted. The abdominal muscles also pull apart in pregnancy, right? So diastasis rectus abdominis, everyone's heard of that. It's common, it's normal to occur in 100% of women in pregnancy. So those muscles or that fascia, the tissue between the two muscle bellies has to thin and stretch, and the baby grows forward and it puts pressure on that, and that separation is normal and it needs to occur for your belly to grow. But it should go back postpartum. And we'll talk more about that in a sec. The next slide. Any questions? Where are we going? Okay. There we go. So the baby comes and now we're postpartum. It's kind of this dramatic change, right? We spend 9 months becoming pregnant and then like in a second we're postpartum. And we're supposed to kind of adjust to that and like figure out what's happening in our body now. So from a pelvic perspective, the first 6 weeks in the postpartum period, it's all about healing. Your body's getting back to normal. There was a crazy stretch in your pelvic floor muscles. The nerves were affected. The connective tissues, the muscles, they get over lengthened, bruised, injured. So it's normal to expect some amount of urinary incontinence. You'll see some ab separation, but that should start kind of over the next 6 weeks, return back to normal. It's okay to start doing gentle, like Kegel exercise sets, as they're called, where you just kind of gently exhaling and drawing in the abdominal muscles and your pelvic floor muscles. But we're not doing a lot of aggressive exercise during the first 6 weeks of postpartum. That's when you heal. These tissues are repairing. You want all of the healing infrastructure to take place without being interrupted. That healing process that's interrupted can lead to some more chronic injuries that are harder to rehabilitate. So gentle movement, gentle contractions of your muscles, that's okay. After 6 weeks, after you check in with your healthcare provider, your OB, your midwife, whoever it is your birthing partner, they'll do a pelvic exam at 6 weeks, check for infection, poor healing, anything that could be, need to be addressed. And otherwise, if things are good and healthy, you're cleared for everything, cleared for everything at 6 weeks. So what does that even mean? It's quite intimidating after that first time. Okay, so you can go back to everything, sex, exercise, everything. But how do you do that? And how do you do that safely? You should also start to see maybe just a little bit more of the leakage. It should start to feel better, maybe a little bit of pain still occurring. Everything should start to be healing. That diastasis rectus abdominis, those muscle bellies should be kind of coming closer together, and you should be able to feel that you're engaging those muscles. If the birth was by cesarean, you can begin gentle scar massage. And really, if you had any tearing into the perineum in your delivery, you can also begin some of that scar massage as well, as long as those cuts and wounds have healed. And then you can, of course, start to be doing more activity and strengthening. Here are some examples. You can see them. They're kind of far away. But here are some examples for your pelvic floor, smart trainer exercises, exercise machines and weights that can be really helpful at like the learning and consistency aspect of pelvic training. And then after 8 weeks, that's when we look and check for more seriously looking at, is this diastasis rectus abdominis healing? Is it something that we need to address? Any questions? Good. And then returning to exercise progression at 6 weeks, again, they've cleared you, but it really isn't go back to what you were doing before pregnancy or go back to what you were doing right before delivery if you remained active. It's a slow and progressive return to exercise so that your muscles, your joints, your pelvic floor can kind of adjust and return to exercise safely. You want to respect your body and the changes that it's gone through, so start slow and kind of ease back. This doesn't mean you can't go do what you've been wanting to do or what you've been missing, but you do likely need to modify the exercise when you return. And running in general, 3 to 6 months before return back to running is what's recommended. It's such a high impacting exercise that shouldn't be the first thing you do. Although I tried and wasn't good, promise, from experience. Next. So with all the changes that occur, what's normal, what's not, and when, and who do I see, and all of that, when should you see a pelvic physical therapist? I'm probably biased, but I think every woman after pregnancy should, no matter what symptoms they're experiencing or not, should see a pelvic physical therapist. There's so much that goes on. But the more obvious things that you need to look out for are continued urinary leakage, pelvic heaviness that might indicate like a feeling that some of the organs may have prolapsed tissue that feels different, is hanging lower. Feeling like you have to pee all the time, like you can't, like I have to, like where all the bathrooms are on the way home from work. Leakage of urine, but also leakage of stool, or you're having a hard time holding back gas. Of course, if there's painful sex and any sort of pelvic pain, even in the absence of sex. Some common causes of pelvic floor dysfunction, we see patients all the time after childbirth, not as often as we should, but childbirth, trauma, chronic constipation is something that we treat in pelvic floor physical therapy. Hormonal changes like puberty or menopause. The sequelae of dysfunction that can occur with the hormonal changes is something that we can address as well. Stress, that plays a huge role in our pelvic floor. Illness, especially those with respiratory symptoms like coughing, all of that pressure and strain on your pelvic floor structures. Overtraining, especially in high impact activities. So like I said, going back to doing something like running too soon. Smoking, obesity, injury to the surrounding joints of the body, cesarean section, all of that. And that is it. So just kind of a quick nutshell, in a little nutshell, kind of a quick overview of pelvic physical therapy, our pelvic floor, our changes in our body from pregnancy to postpartum, and how it can affect us in exercise and return. I don't know in this group how many first-time moms or multiple babies, but there's so much that changes, and there's no question that's too silly for any of us. You shouldn't ever put up with any of these symptoms, and just because your mom had leakage or your girlfriend had leakage or whatever it may be, it's never normal. It's not something you need to put up with, and there's definitely help for you, and we can get you back to moving. So
one question that came in was, how long do you have to wait to do exercises that don't aggravate diastasis recti, so the ab separation?
So good question. You don't want to do any exercises at any point really that aggravate the diastasis rectus abdominis. But what you want to do for sure is wait at least those 6 weeks to allow for some healing to naturally occur. In those 6 to 8 weeks, stuff is going to kind of slowly return back to normal. And if you're doing activities that aggravate some of that healing process, maybe you're continuing to strain some of those structures, then it could contribute to prolonged recovery, or maybe even worsening a diastasis that might have kind of naturally healed. So you're never really wanting to do exercises that aggravate a diastasis, but you are, in those first 6 to 8 weeks, you're doing those gentle abdominal and pelvic floor sets that I was talking about, but returning safely and kind of on the edge of aggravate, like getting to a point where you're kind of stressing the muscle a bit, is a good place to start. Does that make sense? Did I answer that question?
Yeah, I think so.
I kind of have a follow-up question.
Oh, sure.
So I have continued diastasis, and I've got like a packet that I'm working through of different levels of exercises.
Yeah.
And I'm on level 2. And some of the things it's telling me to do, well, I guess I don't know what you mean by, or that question means by aggravate.
Yeah.
Can I do exercises that makes my diastasis stick out, or is that where I need to stop when I see the little coning? Is that?
That's kind of, yeah, so it always depends. And it's always kind of like everyone is unique and different. You need to kind of look at it and assess what is actually going on. But with the diastasis, what we're looking at is controlling pressure in the core. And what we're not wanting, when we see that doming, typically that means we're not doing a good job of managing that pressure, using the muscles and our breath to help to kind of match or meet that pressure. There is an element though of stressing that. Like we know in any sort of like, from an orthopedic perspective, we do want to strain muscles to a certain extent. And when I say strain, I don't mean like injure, but like push a muscle to a point that it can provide a little bit of stress on the muscle so that it can build itself up, right? That's how we build muscle and strength, is we break it down, we apply the stress, and then it repairs stronger. So it depends, but that doming tends to be a warning that maybe this is you've gone into that, this might be a bit too strenuous for that movement, if that makes sense. And that there might be some adjustments, be it more incorporation of the pelvic floor, a slightly different movement, working your breath differently, that can help you accomplish that exercise in a way that doesn't stress. Does that make sense? Okay. Sure. Yeah. No. Again, I've heard it all.
I have like really weird bowel movements the whole pregnancy, like kind of diarrhea the whole pregnancy. Never can't handle that. But it's kind of continued. So I didn't know that pelvic floor dealt with bowel movements.
Absolutely, because the pelvic floor, one of the functions is helping to control the bowel function.
Yeah.
So sometimes when there's overactivity, there's a million reasons what can occur, what can contribute to bowel movements in one way or the other. Be it constipation, be it overactivity. So sometimes working with that muscle to see, is the reason why there's overactivity overactivity of the bowel. So like more production of the diarrhea sometimes can be because maybe we're not emptying our bowels enough. There's something called overflow constipation, where maybe we're not emptying all the stool, and sometimes there is like diarrhea type of stool that could be seeping out. Sometimes it's more overactivity or like central nervous system upregulation. There's so many different things that can contribute. Bowel function is absolutely something that we look at, and pelvic floor physical therapy can help with, if it's related to musculoskeletal or neuromuscular function, absolutely.
And are you here in Dallas?
Yes, so I see patients virtually in Dallas. And we have clinics also in Los Angeles and San Francisco in person. We're moving, out across the country, but at this time, so we see patients virtually in California, Texas, and New York, and then in person in California.
Cool, thanks.
Sure.
So what do you expect in like a pelvic floor therapy appointment?
Yeah, good question. So it's different virtually and in person.
Right.
So I'll speak to a virtual perspective for now, because that's what we're seeing in Texas at this point. You do not have to show your vagina on Zoom. That is always the first question I get, and probably you're thinking it. Yes, shaking heads, nodding heads. But we do, we go through. So it starts with just kind of getting to know what's going on. We ask a lot of questions. We dig into your history, bowel function, bladder function, sexual function, birth history, trauma history. You name it. We will go into it. When you first started your period, all of it can really help paint the picture of what's going on. We get a good sense from what we discuss, where we're going to go for the examination, kind of based on your symptoms, what you said. And then we look at things in a virtual session. We're looking at your movement, your muscle patterns, muscle activation, endurance, strength. We'll teach you how to do certain strength and endurance tests. In the instances of maybe postpartum, we teach you how to assess your diastasis. We might even walk you through doing your own pelvic floor muscle. So if this is my pelvic floor muscle and this is my vagina, we walk you through doing your own pelvic floor muscle assessment to look for things like strength or areas of tension or possible tissue dropping, things like that, and kind of walk you through it. Some people want to do that while we're talking you through it. Often in those cases, we turn off the camera and we talk you through it. Some people will just, hey, let me just do that for homework and let you know what I found, kind of situation. It really just depends on what's going on, and we figure out what your symptoms are and where maybe they're coming from. And then we work through exercises or manual therapy techniques, modifications of your behaviors or lifestyle contributing factors, whatever it may be.
And I think the other important thing to mention is that we are also covered by insurance. So if you have a commercial insurer, we are most likely a network. And so that'll be a lot less than you'd find going somewhere that maybe is doing out of pocket. Yeah,
that tends to be pretty unique in women's healthcare. Honestly, it can be pretty hard to get the treatment that you need and deserve, especially pelvic physical therapy. There's not a lot that provide insurance. Yeah,
there's really not.
Yeah,
it's really hard.
Yeah, yes, but we do take insurance at Origin. So because it should not just be for pelvic PT, should not just be for those that can pay out of pocket. That's silly. So everyone deserves help. You don't have to suffer. So any other questions? Cool. How about on your end, Allison?
No, I was going to just say, I'd love to have Erica get us moving.
Yeah. Sound good? Okay. And I'm here questions at the end too, so if you have anything. I'm not sure. When she turns off
she'll turn
I'm wondering if she'll
Okay.
turn that off.
Okay. Yep.
Okay, cool.
Okay. You're not on camera, I promise. Allison, can you see my mat okay, or can y'all see me okay? Or else I'm gonna watch myself. Okay. I'm gonna flip this. Let's do it this way so it's not so distracting. Okay. There we go. All right, moms. Well, hello virtually. I'm Erica White. Happy to be here. We have some postpartum moms, babies, too, in the room, and we have some pregnant moms, and I think you probably have a couple too. So I'm going to cue to kind of both, and just some exercises that I think are helpful for, whether before or after baby. But let's get started in a wide child's pose. So knees nice and wide, big toes come to touch. And I want you just to take a couple of rounds of breath here, especially for my pregnant moms. Kind of open up the knees a little bit wider if you need to give baby some room. Let that forehead rock back and forth. So good. Now I want you to take a deep inhale through the nose. Feel the belly expand in between your thighs. And then as you take that nice breath out, I just want you to let the day go here. So deep inhale to the nose, fill up. And a nice breath out. So especially in under prenatal pose class, those inhales should be just as long as those exhales, especially for my pregnant mamas, to help us prepare for that labor and delivery breath. So see if you can do that inhale all the way to the top, up and over the crown of your head. And then as you take that exhale, I want you to feel it shoot all the way down the spine and out through your hips. And then this time I want you to make little cupcakes with your hands. So you're gonna activate the fingertips here, and then you're really gonna send your shoulder blades down the spine. So I liked that Allison was talking about kind of that alignment, even from all the way from the spine and the small of your neck. So we can even start that on the mat. I think that helps out a lot here too. So I want you to imagine you're trying to get your armpits to touch the mat, the center of your chest bone to touch the mat. So you kind of feel it all along that upper back. Take one more breath. Good. And then as you exhale, relax the palms, then walk it over to the right side. So maybe that left palm comes on top. and then really shift your weight towards the left. So feel that stretch along the left shoulder, especially for my pregnant moms, left side of baby. Great stretch for that left round ligament. Good. And then when you're ready, walk your hands over to the left, and then lean to the right. Good. Nice deep inhales all the way to the top, and then equal exhales all the way down to the bottom. So nice. And then let's walk your hands back through center. So easy child's pose here, and then let's come up into our easy tabletop. So wrists are gonna be right underneath the shoulders, knees right underneath the hips. Now let's take a few cats and cows here. So on your inhale, drop the belly, lift the chest, and the shoulder bleeds down the spine. And then as you exhale, really tuck your tailbone in, start to reach the pelvic floor, draw your shoulder blades up. So inhale, drop the belly, lift the chest. And then exhale, round it out. So for my pregnant moms, you're keeping the belly soft. For my postpartum moms, you're starting to draw that belly button to your spine. So take a few more rounds here. Deep inhale, drop the belly. And deep exhale, rounding it out. Let's do one more. Deep inhale. And deep exhale. Good. So coming back into that neutral spine, I want you to send your right leg back behind you. So really flex that foot like you're trying to press against the wall. We're gonna come into a little spinal balance, so your left arm is going forward. So you're really squeezing those inner thighs, the booty, and that pelvic floor to hold you up here. Postpartum, you might start to engage the core just a little bit. Now you might stay right here. You might grab that back foot, and if that doesn't feel good, then don't do it. Take one more breath. And then let that left hand come back down. Right foot's gonna go around that left foot. Dig your toe pads into the mat. And then I want you to look over your left shoulder. So feel that left hip bone, kind of like that left side of your glute. Good. And then come back through center. This time we're gonna extend that right leg out towards the right. Take a deep breath in, and then inhale, rise up. Right hand's gonna slide down that right leg. Take that nice big pose, look underneath that left shoulder. And then come into that one-legged child's pose. So come back to sit on your heel, flex the right toes, and then hands go right in between the left knee and the right foot. Let the head and neck go. So this should be that stretch along that IT band. For my pregnant moms, it might be a little bit tender in the inside of your groin. Take one more breath. Good. Come back through center. Come back into your tabletop position. Kind of wiggle it out. Shake it out here. And then we're going to find our first downward facing dog. So I want you to curl the toes. Send the hips up towards the sky. And then let those heels get a little bit closer to the mat if you can. So I want you to shake your head yes and no. No tension in the neck or shoulders. Really pedal out the feet. Bend the right knee. And then bend the left. Doesn't bother. And then my pregnant moms, I want you to open your stance a little bit wider here. And then we're gonna lift those heels, slight bend in your knees. I want you to look to your thumbs and then step to the outside of your hands. So a Malasana squat. So heels are gonna be slightly in, toes slightly out, and then hands are gonna come to heart center. So I like when we check our alignment, I like to shift my weight to your big toe and then shift your weight back to your heels so that your tailbone gets nice and straight here. Let's draw your right ear to your right shoulder. So again, you're engaging that pelvic floor, and then left ear, left shoulder. Now on your next inhale, I want you to rise all the way up to stand. Take your time, squeeze, toes come forward, sweep the arms up and overhead. Now nice wide forward fold, give the belly some room here. And take an inhale and find your nice flat back. And then step it back. So my postpartum moms, you're gonna hold that plank just a little bit longer here. Shift the shoulders over your wrists. My pregnant moms, we're gonna drop the knees down. Take one more breath here. And then as you exhale, knees come down for everybody. And then walk the hands forward, puppy dog pose. So you're gonna keep the hips up nice and high. Chest comes down, shoulders come down. So get that extra opening in that chest. Especially when our milk comes in and we're nursing, we tend to hunch over. So keep it nice and open, so good. Hands come underneath the shoulders and then come back into your tabletop position. So knees under the hips, wrists under the shoulders, and then let's just switch that side out. So left leg goes back, level out the hips here. When you're ready, squeeze the inner thighs, pelvic floor, right arm forward, spinal balance. Maybe for my postpartum moms, you start to engage the core a little bit. You can stay here, you can grab that foot, your choice. Take one more breath. As you exhale, right hand comes down, that left foot's gonna go to the outside for right, like a little curtsy, dig the toe pad, and then look over your right shoulder. Feel it in that right side. As you exhale, left leg comes up and around to the outside of your mat, gently place it down. Inhale, rise. Find that nice gate pose. Left hand slides down, right arm up and over. Come back through center, that one-legged child's pose. You're gonna come back on that right heel, flex the left toes, and then hands come right in between the knee and that left foot. Really dig the heel, feel it in that IT band. And then come back through center. Coming back into your tabletop here, kind of wiggle out that left side, especially if it feels a little bit tight, and then curl the toes, hips go high. So that downward facing a dog again, maybe the heels get a little bit closer to the mat, making sure all 10 fingers evenly pressed into the mat, like starfish in the sand. Now on your next inhale, we're gonna lift those heels up nice and high, soften the knees, come back into that Malasana squat. So sitting it nice and low. So maybe you draw the weight forward to the big toes and then back towards the heels, sitting up nice and tall. Now, if it feels okay here, mom, I want you to send your right hand in front of that right leg, like you're trying to press it away, and then left hand goes up towards the sky. And then switch it out. Left hand goes forward, right hand high. Hands come back through center, same deal here. Squeeze the pelvic floor all the way up to stand. Toes face forward. Inhale, arms sweep up. As you exhale, hinge from the hips, forward fold, just let it go. Inhale, find that nice flat back. Step it back, plank pose. My postpartum moms, you're holding it here for an extra breath. My pregnant moms, knees gently come down. Start to shift the shoulders over the wrists, deep breath in. And then as you exhale, knees come down. Puppy dog pose. Maybe that chin starts to come down to the mat and you look forward. Getting a little bit extra stretch here. Hands come underneath the shoulders. Baby stays off of the mat. We're gonna come into a supported upward facing dog. So knees stay down. I just want you to shine your heart up towards the sky. Feel it in that low back. And then child's pose. Big toes come to touch. Knees nice and wide. Take that deep breath to reset here. Deep breath in. Easy breath out. Now come back in through that tabletop position. Knees under the hips. Wrists come back underneath the shoulders. We're going to extend that right leg back out. Deep breath in. And then we're going to bring that right foot in between your hands. So this is a great use if you have blocks. Since we don't have any blocks today, we're just going to shift our weight forward. And then I want you to swing your arms up towards the sky. I want you to relax the shoulders here and get that nice stretch along that left thigh. So a little bit of strength. I want you to curl your left toes. And then when you're ready, you're going to press up into that high lunge. You really got to engage that pelvic floor. I like to also engage the booty too because it helps me to remember to also squeeze those inner groin muscles. Now take a deep breath here. As you exhale, I want you to see if you can straighten your right leg. Keep that left heel lifted. And then bend into your right leg and see if you can get a little bit lower. So inhale, straight. Exhale, bend. Make sure not to lock that right knee out. Inhale, straight. Exhale, bend. One more. Inhale, straight. Exhale, bend. Get to that lowest point. See if you can hover your left knee. Little double lunge. Hold it here for 3. Squeeze, squeeze, squeeze. 2. Gently start to lower that knee. 1. Relax the hands. Hands can come back down to the mat. And then let's straighten that right leg. So let's bring the hands for my pregnant moms inside that right foot so you're not squishing the baby, and flex the toes. Really stretching out that hamstring. Take another breath here. And then come back into your tabletop and let's take some big hip circles. So making them super exaggerated, over to the right, to the front, to the left, and to the back. Making sure you do a couple in both directions, even if your hip starts to pop. Good. So nice. And then we're gonna come back into your tabletop when you're ready. So knees under the hips, wrists under the shoulders. Left leg goes back, take a deep breath in. And then as you exhale, left foot comes in between the hands or outside of your hands if you need more room. And then arms are gonna swim up towards the sky. So really feel that stretch along that right thigh. So that shift the weight forward, relax the shoulders. We also tend to clench our jaw, so I want you to relax the jaw here. Now when you're ready, start to curl the right toes. Squeeze, squeeze, squeeze as you lift that knee off of the mat. Tuck the booty under. Stare at something that's not moving in front of you because we're going to straighten that left leg. See if you can keep the right heel lifted. And then as you exhale bend. So inhale straight. Exhale bend. You have two more. Inhale straight. Don't lock that knee out. Exhale bend. See if you can get a little lower. Last one. Inhale straight. Exhale bend. Hold it here. See if you can hover that right knee for 3. For 2, start to lower it all the way down. 1, hands come inside that left foot, straighten that left leg. Flex the toes. Breathe into that hamstring. 1 more breath. So good. And then come back into your tabletop position, wiggle it out. Shake it out here. Good. And then we're going to come and have a seat and stretch out our hamstrings a little bit further. So having a seat here. So for my postpartum moms, you're obviously bringing your legs back in together, helping those hips get back into place. But for our pregnant moms, you're opening up, allowing room for baby here. Flex point, ankle circles, just kind of breaking everything up from the day. Especially if you have swelling or, you know, the humidity in Texas does not help that either. And then let's flex the toes, arms go up and overhead. Deep breath in. And then as you exhale, I want you to reach for your toes. So whether you grab your toes or not, maybe hands just rest on your shins. I want you to draw your chest forward, like you're trying to puff your chest towards the top of your mat. So feel that release along the small of your back. Breathe into your hamstrings. Take another breath here. And then as you exhale, one of my favorite poses for pelvic floor is a reverse tabletop. So hands are gonna come back by your waist. Press your feet into the mat. Squeeze as you lift those hips up towards the sky. Deep breath in. And then as you exhale, gently release it down. So we're gonna move through that 2 more times. So release the feet out. Inhale, arms sweep up. As you exhale, reach for the toes. Inhale, chest comes forward, breathe. Hands come back by your hips. Reverse tabletop. See if you can go a smidge higher here. Maybe the head and neck starts to go back. And then as you exhale, gently release. Let's do that one last time. So legs go long. Inhale, arms go high. Exhale, reach for the toes. Inhale, draw your chest forward, breathe. And then hands come back by your waist. Feet come into the mat and then press it up. Now maybe the head and neck starts to go back behind you. Start to feel it in that shoulder girdle. Take a deep breath in. And as you exhale, gently release the hips. So we're gonna windshield wiper the legs. Feel that nice release. Good. And then just come into an easy seated position. So I just wanted to kind of finish up with doing some kind of arm and chest, because I think that's so important for alignment. And as Ashley was talking about, it really kind of helps even from a pelvic floor perspective. So I know moms that are virtual might not have a strap, so I will do it without a strap. But if you have a strap at home, you can do this with like a bathrobe strap or like tie from your partner or whatever. But if you have that strap, for my moms in the room, I want you to kind of fold it just maybe like one time and then bring it a little bit outside of your shoulders here. So if we're not in that strap and you're at home, you'll just follow me. So on your inhale, I want you to send that strap up and overhead. Now you're gonna take the strap for my moms in the room and take it back behind you. For my mom's virtual, I want you to cactus the arms here. Now don't push too much in a baby if you're pregnant, you're still tucking the tailbone. And then for my mom's in the room, yeah, and let the head and neck go. Good. Now inhale, come back through center, and then exhale, just bring the hands back down, kind of wiggle out the shoulders, just kind of feel it out. And then let's do that again. See if you can go a little bit deeper. So inhale, take that strap or arms up and overhead. As you exhale, either cactus the arm to the strap, go a little bit further, not pressing too much into the belly. And then as you exhale, gently release it back down and kind of wiggle it out. All right, so now this time. So inhale, we're gonna take the strap or arms and up and overhead. Now, if you have the strap, I want you to grab it with your right hand, draw it over to the right, look under your left shoulder. If you don't have that strap, left hand comes up and over, then really press that right palm into the ground so you're pressing into your left hip. Good. Create that resistance, look under the left shoulder. Inhale, come back through center. And then exhale, let's switch it out. So draw that left hand down, look underneath that right shoulder, side body stretch. So nice. Inhale, come back through center. Let's do that one more time, side to side. So right hand down, left hand comes up and over. Good. Inhale, come back through center. Exhale, other side. Nice. Inhale, come back through center. Go ahead and release the strap if you have it. Wiggle out the shoulders. And then we're just going to take a little gentle twist here. I still think it's important from a chest perspective to do it. So left hand is going to find that right knee. For my pregnant moms, all you're doing is looking over your right shoulder, feeling that stretch along the left side of your neck. That right hip bone is still facing forward, and so is baby. Take another breath. On that inhale, I want you to feel a little bit taller. Exhale, maybe you look a little bit farther behind the right shoulder. And then last one, let's turn to the left. As you exhale, right hand to that left knee. Baby stays facing forward. Postpartum moms, you can do a twist. Good. Inhale, come back through center. And then exhale, we're just gonna sit up nice and tall. So tops of the hands, wrists under knees, palms facing the sky. Just want you to shut down your eyes for a brief moment. I always like to kind of end my class with saying time to ourselves, especially as moms, are very few and far between. So I just want you to take a moment to be grateful, and grateful for the time that you were able to take for yourself today. And just taking this moment, even if it's a few minutes, or maybe you get something longer during your week, to take this moment to feel recharged and reset and ready to conquer a new day. As we send our inhale, sending our arms up and overhead. Last breath in. As you exhale, palms come together and release to your heart center. Let's honor one another and honor our practice and honoring our babies as we all say together, namaste.
Oh my gosh, Erica, thank you.
Okay, good. I was like,
oh, that was so good. I turned my video so people didn't have to watch me, but that was incredible. Thank you so much.
Sure.
Oh, you should have heard, maybe you did hear all the sweet baby noises though. That was.
Oh yeah.
Oh, so sweet. Awesome. Well, did any other questions like pop up during any of that, or any of you guys virtual, anything?
I don't think
Would
so.
it be
Thank you.
Okay, awesome. Sorry.
Would it be possible to share the presentation, or did you say it was recorded?
Yes.
Yeah. I'll share the recording, Erica, and then I can send you the presentation as well that you can share out with with all the moms.
In the room want the presentation or whatever.
I'm perfect. Amazing. Thank you, everyone. Thanks so much.
Okay, bye.
Bye.